in a short way, the best way you can describe it, if you can talk to me about your overall experience here at JC.
Yeah.
Okay.
So I started out insanely sick, and I went to like multiple doctors that all said like Lyme wasn't real, and they told me I had chronic fatigue and all these things, and even the testing here wasn't accurate. So once I got a positive test from a place overseas, we tried to find sort of a place that would work. We did homeopathic stuff and all that, and my skin was like turning gray and my organs were starting to shut down, and I was like getting migraines, and it was right at like the brink of just like death. Like it was the worst I could possibly describe it, my mom. So we got here and they were like confident that I would get better, and so I was like, I'm just gonna stick this through because this is the last option. And so I started insanely sick, and I've been on oral pills for 3 years, and I just started IVs like today.
Okay.
And when I started, I couldn't even walk up the stairs by myself. Like I couldn't even think. Like I forgot like years of my life. Like I literally couldn't do anything alone. I couldn't go to school, work, anything, not even go outside my house. And now I'm taking some classes at school, and I'm a junior in college, and even though I have to go slower than most people, it'll take me a little longer. I get to like go to class and actually do things, and I have to adjust it a little, but just the fact that I can go to school, and I make costumes, so for like conventions, and I spend like hours on it, and I can actually like make them and spend time on them. And yeah, this is like the place that sort of saved my life.
Awesome.
And a lot of people don't think that young people have Lyme, but they totally believed me. And I went to a lot of people who are like, you're too young to have that or something.
So I want to ask you about that.
Yeah.
Talk to me about the symptoms.
Yes.
So because Lyme is really, really controversial. So it's like the symptoms vary. So talk to me your specific symptoms and what you were told.
Yes. So I have like bone, nerve, muscle pain. That was kind of my biggest thing, was just overall pain. I couldn't do anything. Really, really bad nausea. Like felt like I had the stomach flu all the time. I had TMJ, so my jaw wouldn't open very much, and I'm a singer, so that was like devastating. I couldn't open my mouth. So it would cause insane migraines. I had insane like vision loss. My liver started shutting down. I had the gallbladder issues and breathing. Like I would stop breathing in the night, and heart palpitations. And the pain was sort of the biggest thing, like pain, nausea, and then fatigue, like being insanely tired, not being able to do anything, like falling asleep. And so when I went to doctors, they were like, oh, you're either making it up because you're like a kid. Because I started looking for doctors around when I was like 14, and I didn't get diagnosed until I was like 18, 19. And so like we sort of came here when we were 17, and then we actually got like diagnosed a little bit after that. And I mean, I got bit with a tick when I was 7. And most people don't remember that, but I was really I exaggerated everything when I was 7, so I remember the ticks. I flipped out. And that was in Texas, and most people think that you can't get bit anywhere other than like the East Coast. And I'm from Colorado, and so I have a cousin that also has it, and she got bit in Colorado. But a lot of doctors told me that Lyme disease, chronic Lyme, wasn't real. They believed in like the 1 month you just take doxycycline and then it kind of goes away. But they were like, you wouldn't have symptoms this long with Lyme. So I was told I had chronic fatigue, fibromyalgia, plantar fasciitis, all sorts of things like chronic migraines. So they kind of said chronic this and that, because they told me Lyme is in no way real. And the only person that believed me was a chiropractor, not actual doctors. They said, like, oh, the literature in this says that it's not real, and in school we learned it wasn't real. So like doctors said that they just learned it wasn't real. They were told it wasn't real, and they believed their professors, obviously. And so they just didn't want to look into it, because in school they said they made a big deal about how it just wasn't real, and people, you know, you got to tell your patients that. So I thought it was interesting that they learned that in school, and that they didn't even want to like read anything about it. So they just, I mean, all like the medical professionals, other than that chiropractor, completely told me it wasn't real and that my symptoms weren't related to that. So at the very end, they were like chronic fatigue, and that's sort of just when they don't know what you have, they just tell you that. But my mom was like, no, that's not an answer. But
So,
it was interesting that most people were like, it's not real, and they're like, it'll be controversy. People online will give you like conspiracy theories that it's real, but don't listen to people online, they're not doctors. So it was very hard to figure out what was the truth, because you want to believe doctors.
in general, talk to me about your treatment here at JAC, Jemsek Specialty Clinic, your individual treatment. I mean, not in detail, but how did your treatment change that, basically your life?
Yes, so I came in here and I couldn't do anything. Like I was like, my life isn't gonna happen. Like I just was like, it's like I'm gonna die. Like it was so bad that I just felt like my body was gonna shut down and I was gonna die in any way. I know a couple Lyme people that couldn't get treatment somewhere and they passed away, like 2 of my friends. So this was kind of last resort. So I started with oral antibiotics and I herxed really bad, which is like the die off. You feel really bad from it. And I would feel horrible during the day, and I was like, how is it that I feel bad to feel better? And after that first year, I started seeing like improvements. It was very slow, but when you're determined to get through it, you slowly, like every year, see the differences. And in the second year, I could start online classes and actually go out and do some things with my friends. And of course, like the antibiotics change every so often, so it started getting more bearable the longer you go on, even though it's long. It's a marathon, so you just kind of have to go like slow. But if you really hold on to getting to the end goal, it continually gets better. Like every couple months you see improvements, and it does take a really long time, but it's completely worth it. And I literally, if I didn't come here, I wouldn't have even been able to like stand up and even talk like this. So the treatment here is amazing, and even though it's slow, that's the whole point. You really have to kind of feel worse to get better. And a lot of people don't understand that it's worth it, the end goal. Like it's slow, but I could see small improvements that turn into a big improvement. So I'm about 50-60% better right now.
Wow. Okay.
So, yeah.
So if you can say what Lyme has taken away from you, what's the number one activity that you would believe that, I used to love this, but I stopped loving it, and right now I'm enjoying it?
Well, because
I'm getting there.
Yeah, I'm young, so I'm about to turn 21, and so it's really difficult seeing people like study abroad and travel and go to school like all day and go to clubs and activities and do things and be in sports teams. So I think just participating in what the people my age do, like going out and hanging out with groups of people and going places and going on road trips, and like me, I'm a performer, so not being able to do like theater and singing and like doing what I love. But now that I've gotten a little better, I'm a music therapist at a hospice facility. And at school, I sort of changed around what I've wanted to do based on this. I want to do occupational therapy and be a missionary in like third world countries, because it is everywhere over the world. So I do want to like bring awareness to it. And I am able to like do things with my friends now. I do have to like pace it, but I can go out. Like New Year's, I was actually like able to go out and do something. And I work at a haunted house, and so I was able to act this year, and before I would just kind of have to sit there and watch other people do stuff. But it isn't as much as other people do, but the big thing was taking away like my youth. Like people would tell me, college age, you have to like really embrace what that is. It's the best years of your life type deal. So kind of just feeling like I was going to miss out on that and miss all of that sort of best years of your life. But now I'm able to participate in things that I wasn't able to do before.
That's awesome.
So I'm able to like help with theater stuff and do all that. So some of my I started doing makeup because I couldn't act, and now my makeup's sort of my big thing. So I do makeup for the shows now, and so just being able to even be a part of that I didn't think that I'd be able to ever do that again.
Nice.
So yeah.
Yeah. So last question.
Yes.
If you can, for someone out there who is going through what you went through, what piece of advice would you give them?
To not give up on your life, because I get emotional, but yeah, I come here and I like see people in the waiting room and they're like just overwhelmed with not being able to get better, And I just see like the pain that people are in, and they just don't even think they're gonna get treatment, and they're not gonna get better, and they just like give up. And I think the big thing is to be determined that you are gonna get better, and that if I can get better, I think anybody else can. And just seeing, I know people that went through the treatment here, and they're going like hiking, and they're like working again, and so it's just like incredible to see people here get better when I can see so many people in pain. So I think just like you're able to get better and stuff, and it's so like hard to like go through this, and the only way you can understand it is if you've gone through it as well. And so I think just you're gonna be able to get through it. So I think just holding on, because it's really long treatment for something like this, and people think it's very quick, but it is taking a long time. So I think if you just can hold on and kind of just go through those like handful of years, it's worth it completely. So I think just like don't give up on getting treatment. Don't just be frustrated, because it took me years, so it's worth it though. So.
Don't give up. Thank you very much. I really appreciate it.